Hi everyone, this is Singh. I welcome you all on my channel Medico's Maharathi. Hope you all are happy and healthy. My dear friends, today we are going to discuss some mixed bag questions of Pediatrics Fmge 2017 to 2020. So आज हम कुछ mixed bag question discuss करने वाले हैं किसके Pediatrics के एग्जाम कौन सा है FMG टाइम पीरियड क्या है 2017 से 2020 तक के जो क्वेश्चंस आए हैं उन्हीं में से कुछ मिक्स बैक क्वेश्चंस का आज हम क्या करेंगे डिस्कशन करेंगे. ओके, सो इफ यू आर न्यू टू माय चैनल देन इट्स करेक्ट टाइम फॉर सब्सक्राइबिंग माय चैनल and press on notification bell icon so that you can get updates for all important upcoming videos. And another update, if you are new to my channel, then every day Medico's Maharathi upload 4 videos. One video in early morning, that is question of the day. Okay, after that in evening, drug of the day, and after in evening 10 p.m. two videos are uploaded. One is mixed bag questions of any subject, okay, and other is image of the day. So all these videos are targeting all upcoming exam, whether it is next NEET PG, FMG, INI set. Okay, so let's start our discussion. So question number one. So here you can see our question is which is most specific clinical feature for diagnosis for Kavish-Yorker. Okay, so examiner is asking most specific clinical feature. Okay, and you have 4 options and you have to choose one correct choice. Okay, and the correct choice will be option number D. Okay, correct choice will be option number D. Okay, option number D क्या है? Edema. So edema, it is most specific clinical feature for diagnosis for Kavish-Yorker. Okay, and in 2018 examiner asked a one-liner question. The question was the specific sign for Kavish-Yorker. The specific sign for Kavish-Yorker is pitting edema. So जहाँ Kavish-Yorker दिखेगा उसकी मोस्ट स्पेसिफिक क्लिनिकल फीचर क्या है? इडेमा. और यही सेम क्वेश्चन कब आ गया? 2018 में. ये कब आया था? 2017 में. ओके, एंड माय डियर फ्रेंड्स, अनदर thing I want to tell that I already made a video for all questions of pediatrics of FMG 2017. Okay, only 2017 के जितने भी क्वेश्चंस हैं उन पर एक वीडियो मैं बना चुका हूं. उसमें सारे क्वेश्चंस है जो पीडियाट्रिक्स के FMG में आए हैं 2017 में. ओके, सो it is only one question here. Next you will get of 18, 19 and 20. Okay, so next question. A child aged 2 years present with non-specific symptom suggestive of anemia, peripheral smear showing target cells. He has microcytic hypochromia and HB of 6 gram percent. There is positive family history. Next investigation is. So what do you think? What will be the next investigation in this case? Okay, so my dear friends, next investigation in this case will be option number B. HbA1c estimation is next step of investigation. Okay, so you can see here the child is 2 years, okay, and present with non-specific symptom of which are suggestive of anemia, peripheral smear showing target cells. Okay, so it is very important, target cells, and he has microcytic hypochromia and HB of 6 gram. Okay, so according to this, the next step in investigation will be HbA1c estimation. Okay, what is our next? So our question number 3, it is from 2018. Vitamin A is leading cause for preventable childhood blindness. A parent brings her 18-month-old child to doctor for routine eye checkup. Doctor noticed thin out cornea. Okay, from old record, it was also seen that child has iron deficiency anemia. Weight of child is 10 kilogram. What should be dose of vitamin A if doctor make it as keratomalacia? So the question is hidden in last line. What should be dose of vitamin A if doctor mark it as keratomalacia? So you have to choose one correct choice from given below 4 options. Okay, so the correct choice will be option number C. It will be 2 lakh IU. Okay, it will be 2 lakh international unit. Okay, so you can see here that age of children is 18 months. Okay, so option number A is 50,000 international unit. So it is generally for children of age 6 month और you can say less than 6 month. Okay, so अगर बच्चा 6 महीने से कम का है उसके लिए क्या है, ऑप्शन नंबर ए. So you can mark if age is mentioned 6 month or you can say less than 6 month. अगर less than 6 months है तब उस केस में क्या होएगा, 50,000 IU. Okay, if the age of baby is 6 month to 12 month, 6 से 12 है तब आएगा ऑप्शन नंबर बी. सो ऑप्शन नंबर ए करेक्ट कब होगा, लेस देन 6 मंथ्स. ऑप्शन नंबर बी करेक्ट कब होगा, 6 मंथ से 12 मंथ. ऑप्शन नंबर सी कब करेक्ट होगा, इट इज ग्रेटर देन 12 मंथ्स. अगर 12 मंथ से ज्यादा है उस केस में क्या होगा, ऑप्शन नंबर सी. ओके, एंड सेम डोज इट इज रिपीटेड इन नेक्स्ट डे एंड 4 वीक्स लेटर. ओके, सो ये सेम डोज रिपीट होगी. सो 6 महीने से कम का है उसमें ऑप्शन नंबर ए, अगर 6 से 12 का है तो ऑप्शन नंबर बी, और अगर एज उसकी है कितनी, 12 से ज्यादा, तो ऑप्शन नंबर सी, 2 लाख इंटरनेशनल यूनिट. ओके, so this question is done. Let's move to next question. So here our question is, Menkes disease is due to defect in metabolism of, and examiner given you here 4 option and you have to choose one correct choice. Okay, it can be A, B, C, D, any of one. So the correct option for this question will be option number B. Menkes disease is generally caused due to defect in metabolism of copper. Okay, next question is that if examiner ask, examiner give you option, in question examiner will give Menkes disease is, it is X-linked recessive disorder. Okay, it is X-linked dominant disorder. Okay, it is autosomal recessive disorder or it is autosomal dominant disorder. What you will choose, my dear friends? Menkes disease is X-linked recessive disorder and it is generally caused by mutation in gene coding for copper transport protein, that is ATP7A. Okay, and you can see copper level is low in liver and brain and high in enterocyte and fibroblasts. Okay, and if we talk about clinical feature, you can see growth retardation, you can see brain involvement. If you are seeing brain involvement, you can see delayed milestones, seizures, hypotonia, you can see hypothermia. Okay, and patient with classic form of Menkes disease generally dies before 3 year of age. Okay, so Menkes disease के जो पेशेंट है उनकी डेथ कितने टाइम में हो जाती है, 3 ईयर से पहले हो जाती है अगर वो क्लासिक Menkes डिजीज के पेशेंट है. ओके, and you can see hypopigmented kinky hairs. On microscopic examination you will see twisted hair and you will also see fracture along the hair shaft. Okay, so this is about our this question. Let's move to next question. Chronic malnutrition in child, chronic malnutrition in child is best evaluated by which option? You have to choose one correct choice. Okay, it is best evaluated by which option you will choose, my dear friends? Correct option for this question will be option number C. Okay, option number C will be correct choice for this question. Chronic malnutrition in child is best evaluated by height for age. Okay, if examiner give you a question that acute malnutrition, it is best evaluated by, then which option you will choose? Same option are given here and instead of chronic here is written acute malnutrition. Then you will choose weight for height. Then what you will choose? Weight for height. Okay, अगर सेम क्वेश्चन है क्रोनिक की जगह एक्यूट कर देता है क्वेश्चनर एग्जामिनर तो ऑप्शन नंबर ए करेक्ट होगा. यहाँ पर क्या पूछा है, क्रोनिक है तो क्रोनिक में ऑप्शन नंबर सी करेक्ट है. एक्यूट होगा तो कौन सा करेक्ट होगा, ऑप्शन नंबर ए करेक्ट होगा. ओके, सो दिस क्वेश्चन इज आल्सो क्लियर. लेट्स मूव टू. So our question number 6 is wide open posterior fontanelle, large tongue, rough dry skin with constipation is seen in which of the following? You have to choose one correct choice. So my dear friends, you can see these all features in option number C, that is hypothyroidism. In hypothyroidism, you will see wide open posterior fontanelle. large tongue, rough dry skin with constipation. Okay, and you can also see the skin is dry and scaly. You can also see abdominal distension. You can also see umbilical hernia. So what you can see, if in one line I tell wide open anterior and posterior fontanelle, you can see physiological jaundice, myxodermatous facies, large protruded tongue, dry skin, scaly skin, hypotonia, hypothermia, constipation, abdominal distension, umbilical hernia. So these all features you can see in case of hypothyroidism. What is our next question? 3-month-old baby with fever and respiratory rate 60, irritable and well fed, no stridor, no chest syndrome, no convulsion. Diagnosis will be. You have to choose one correct option for this question. Diagnosis for this question will be option number A, pneumonia. It is case of pneumonia. Okay, so you can see these all features which are present here in case of pneumonia. Okay, so this question is also done. Okay, what is our next question? Next question is, what should be best initial feeding method for baby born at 33 week of gestation with no perinatal complication? So you have to choose. It is a one liner question. Okay, examiner is asking simply a best initial method for a baby born at 33 week. Okay, so feeding का method पूछा है, baby कब born हुआ है 33 weeks में. Examiner given you here 4 option and you have to choose one correct choice. Okay, and correct choice for this question will be option number D, Paladai feeding. It is Paladai feeding. You can also say it as Katori spoon feeding. If the baby is born between 32 to 34 weeks, then you will follow this type of feeding. 32 से 34 वीक में अगर बेबी बोर्न हुआ है तो उस केस में ये फीडिंग फॉलो होगी. ओके, अब एक और ऑप्शन है, ऑप्शन नंबर सी, ओरोगैस्ट्रिक ट्यूब फीडिंग. When you will do this, when you will follow this method of feeding, you will follow this method of feeding when the baby is born between 28 to 31 week. अगर 28 से 31 वीक में बेबी क्या हुआ है, बोर्न हुआ है, तो उसमें क्या होगा, ओरोगैस्ट्रिक ट्यूब फीडिंग, और यू कैन आल्सो से इट एज गैवाज फीडिंग. ओके, एंड IV फ्लूइड्स. ओके, IV फ्लूइड्स फीडिंग मेथड कब फॉलो होगा? ऑप्शन नंबर ए, व्हेन द बेबी इज बोर्न लेस देन 28 वीक्स. ओके, अगर बेबी का बर्थ कब हुआ है, 28 वीक से पहले हुआ है, तो ऑप्शन नंबर ए फॉलो होगा. अगर बेबी का बर्थ हुआ है 28 से 31 वीक में, तो ऑप्शन नंबर सी फॉलो होगा. अगर बेबी का बर्थ हुआ है 32 से 34 वीक के बीच में, तो उसमें होगा ऑप्शन नंबर डी फॉलो. ओके, एंड ब्रेस्ट फीडिंग कब फॉलो होगा? जब बेबी का बर्थ होगा 34 वीक्स के बाद में. ओके, उसमें क्या होगा, नॉर्मल ब्रेस्ट फीडिंग पैटर्न फॉलो होगा. ओके, सो दिस क्वेश्चन इज आल्सो डन. ओके, so let's move to next question. So our question is, a child has large head, large tongue, and his both the testicle are large in size. A child has also feature of autism spectrum. What is probable diagnosis? Okay, so examiner is asking probable diagnosis for autism spectrum disorder, and it is present with this feature, large tongue. Okay, testicle are large in size, and you have to choose one correct choice. So correct choice for this question will be option number B, fragile X syndrome. fragile X syndrome. fragile X syndrome होता कैसे है, कौन सा जीन म्यूटेशन होता है, इट इज आल्सो अ क्वेश्चन. सो यू कैन सी म्यूटेशन इन FMR1 जीन ऑन X क्रोमोसोम लॉन्ग आर्म. ओके, सो फ्रेजाइल X सिंड्रोम में कौन सा जीन म्यूटेशन होगा, FMR1 जीन म्यूटेशन होगा. ठीक है, फ्रेजाइल X सिंड्रोम में तो ये म्यूटेशन होगा. अब बात की जाए कि ऑप्शन नंबर जो डी है, ऑप्शन नंबर जो ए है, ऑप्शन नंबर जो सी है, उनमें क्या हो सकता है. रेट सिंड्रोम इज मोर कॉमन इन फीमेल्स देन rather which has having small head. so Rett syndrome किसमें कॉमन है, फीमेल्स में कॉमन है, सो इस क्वेश्चन में तो हो नहीं सकता ये, ठीक है। Eisenmenger syndrome. Eisenmenger syndrome, it is generally condition seen with heart disease where there is reversal of shunt due to irreversible obstructive pulmonary vascular changes. Okay. And option number D, it is seen in case of microdeletion in chromosome number 7, and this individual will show you hypercalcemia and supravalvular aortic stenosis and facial dysmorphism. So सबकी सब फीचर्स किससे मैच कर रही है? फ्रेजाइल एक्स सिंड्रोम में। फ्रेजाइल एक्स सिंड्रोम मोस्टली होगा किसमें? बॉयज में होगा, ठीक है, मोस्टली किसमें होगा? बॉयज में होगा। और इसकी फीचर्स क्या हो सकती है? द बॉय विल हैव लॉन्ग फेस, लार्ज ईयर, high arc palate, megalocephaly, large head, autism behavior. Okay, so here you can see autism spectrum disorder. So ये सब जो फीचर्स है वो किसको स्पेसिफाई कर रही है? ऑप्शन नंबर बी को। You can also see mitral valve prolapse, scoliosis. You can see pre-mutation males, fragile C associated tremor, ataxia syndrome. Ataxia syndrome generally seen in females. Okay, सो ये कुछ फीचर्स हैं। पहली बात तो ये मोर कॉमन है किसमें? बॉयज में। तो यहाँ पर ये क्वेश्चन इशारा किसकी तरफ कर रहा है? ऑप्शन नंबर बी की तरफ। ओके, ऑटिज्म स्पेक्ट्रम जो डिसऑर्डर है वो भी किसमें शोन हो रहा है? इसी में, फ्रेजाइल एक्स सिंड्रोम में। ओके, लार्ज जो है टंग, ओके, लार्ज टंग, लार्ज हेड, ऑल दीस आर क्लिनिकल फीचर फॉर fragile X syndrome. This question is also done. What is our next question? All of the following are components of teratology of phalloid except option number. Which option number will be correct choice for this question, my dear friends? Correct choice for this question will be option number B, tricuspid stenosis. Okay, so all of following are component of teratology of phalloid. So overriding of aorta is component, right ventricular hypertrophy is component, ventricular septal defect is component of teratology of phalloid, but option number B is not component. So option number B क्या है? Component नहीं है इसका, teratology of phalloid का। Okay, सो चार कंपोनेंट्स होते हैं टेरोटोलॉजी ऑफ फैलेट के। लार्ज वेंट्रिकुलर सेप्टल डिफेक्ट, पल्मोनरी स्टेनोसिस, ओवरराइडिंग ऑफ aorta, राइट वेंट्रिकुलर हाइपरट्रोफी, and most common congenital cyanotic heart disease seen in children. Okay, so most common congenital cyanotic disease किसमें सीन होगा? चिल्ड्रंस में। Okay, so what is our next question? Next question is, a mother brings her neonate to a doctor with complaint that it has been 6 hours since the baby had not passed stool yet. Yet for how much time shall we observe before labeling it as delayed passage of meconium? Okay, so you have to choose one correct choice before passing of meconium. So how much time they shall wait? They shall observe. So my dear friends, correct choice will be option number B. Okay, meconium. Wait for 48 hours before labeling it as delayed passage of meconium. Okay, 99% of full-term healthy neonates pass meconium in first 48 hours of life. Okay, so अभी बच्चे को जन्म में कितना हुआ है? 6 आवर हुआ है। और बेबी कितना है? फुल बोर्न बेबी, न्यू बोर्न बेबी takes 48 hours of time. Okay, till that hours the baby will pass meconium. Meconium, it is first stool passed by baby, which is greenish in color and thick consistency. If examiner ask you composition of meconium, it will comprise with amniotic fluid, mucus, langue, that is hairs, bile, and intestinal epithelial cell, and water. Meconium, it is sterile substance, but if aspirated causes meconium aspiration syndrome. This is a normal case scenario. Okay, so this question is also covered. What is our next question? So our question number 12 is, a 6-day-old child with respiratory distress syndrome solved following finding on chest x-ray? What is diagnosis according to chest x-ray and history given above? So my dear friends, you can see in this chest x-ray many things. Okay, and from that you have to diagnose a correct option, and the correct option for this question will be option number A. It is a case of congenital diaphragmatic hernia, and in this chest x-ray you will see bowel gas shadows in thorax. You can see the mediastinal shift. You can see mediastinal shift of heart along with pulmonary hypoplasia, and you can see these shadows of bowel shadows in thorax region. Okay, these shadows are seen in thorax region, and you can also see, so three things you can see: bowel gas shadow, mediastinal shift of heart, pulmonary hypoplasia, and these all are suggestive of congenital diaphragmatic hernia. Okay, diaphragmatic hernia, according to this choice, is a correct option. According to these features, a correct option. Okay, so this question is also done, and my dear friends, this is end of our today's discussion. We discussed 12 questions, and all these questions are from 2017 to 2020, and many of which are repeated twice thrice. Okay, not same questions, but a concept from that question is repeated twice thrice. Okay, so this is a mixed bag question discussion of pediatrics. Hope you all feel that this video is helpful. If you feel that the video is helpful, then you have to do three things: like this video, share this video, and subscribe to my channel, and press on notification bell icon so that you not miss any update upcoming in future.